For the last couple of years, mental health and how we respond to mental health crises and emergencies have been at the forefront.
Are we getting APD on this call?
Marissa Aguilar.
And what's your title?
Practice Manager of the Expanded Mobile Crisis Outreach Team. I think when we go and do our follow-up with her, we can kind of explore that with her again. I'm a licensed professional counselor. I have a master's degree in counseling.
The self-injurious behavior, a lot of times that's trauma-driven.
And I specialize and have expertise in trauma, crisis intervention, suicide intervention and prevention.
Are you currently safe today?
And working with individuals who have serious mental illness. During my day-to-day here at Integral Care, I oversee the clinical operations over Integral Care's Expanded Mobile Crisis Outreach Team.
Medcom EMCOT.
Or EMCOT.
EMCOT, Medcom, go ahead.
Or Integral Care's Expanded Mobile Crisis Outreach Team.
Responding to page at 5015 South IH 35, ETA is going to be 25 minutes.
Copy, ETA 25 minutes.
I'm at LMSW, so licensed master social worker.
9 still responding, Medcom.
So we get a page, and just from that we'll be able to tell if it's the police or EMS calling us. And so since that one was EMS, we use a radio to communicate with them, to notify them that you got the page, let them know our ETA, and then we pretty much leave right after that and head to the address.
Paramedics and EMTs have to respond to a wide variety of emergencies, gunshots and strokes, heart attacks, just general illness. Mental health, we're fortunate. We have a resource in our community that can come out and help us kind of sort through what options are best for this individual. So when it comes to responding to an individual that's experiencing a mental health crisis or emergency, one of our best resources that can help sort through what resources are available and would best suit this individual's needs would be a service like the Mobile Crisis Outreach Team with Integral Care.
Integral Care's EMCOT clinicians are all master's level clinicians. We have licensed professional counselors, marriage and family therapists, and social workers. Our team started in 2013 to expand services to meet individuals in crisis. So EMCOT receives referrals only from first responders and criminal justice systems.
They have access to a variety of different services, hospitalization, psychiatric emergency services, respite services, or maybe keeping them in the home. And they're trained professionals that know how to kind of sort through those best options and keep the patient safe.
Integral Care is one of our strongest partners in the community. We couldn't help the community the way we can now without our strong partnership. Determine if it's involuntary or voluntary. If it's voluntary, point them to Integral Care. Integral Care is the experts in our community on psychiatric treatment and solving somebody's crisis somehow, whatever that might be.
We're very fortunate here in Austin to have them.
And they really focus on suicide lethality risk assessments because the number one reason
Can you scoot back a little bit that way?
EMCOT is referred out into the community is for individuals that are having thoughts of suicide.
I'm going to take you to Dell Seat and I'm going to talk to the case manager.
What we do at the beginning of our shift is we radio in to 911 Communication Center and say we're logging on for the day.
Stay on the line, I'll tell you exactly what to do next.
So that 911 call center takers know that they can dispatch us and we're ready for calls.
Take care. You're welcome. Bye.
We do the same thing at the end of our shift so that they know when we've logged off. During the day, what clinicians are doing is they are available at multiple locations within the county in order to have rapid response to first responders that are requesting us out into the community to provide assessments for individuals in crisis. We have clinicians that are at a South Integral Care location. We also co-locate at 2 paramedic stations, one in North Austin, one in East Austin, and then we co-locate with APD and Travis County Sheriff's Office Crisis Intervention Team at Austin State Hospital. The team also provides ongoing follow-up services after that initial crisis assessment. So we can serve individuals in the community for up to 90 days. In those 90 days, what we're really looking at doing is helping support that individual through their crisis and linking them to ongoing services.
We also need them to be aware for a large portion of their call volume those other issues that somebody may be experiencing that's preventing them from accessing healthcare or necessary services. Answering the question or being able to address why they can't get in to see their own doctor or why they can't get their prescriptions filled, and being able to identify those issues. Then we may send in people like CHP to address those longer term issues while we save the ambulance for those other immediate 911 emergencies that need an ambulance to respond right away.
Now, once we arrive on scene, our goal is really to best serve that individual in crisis and look at the best use of our resources within the community. So if we identify there's not a safety concern for the individual or for the clinician in the environment they're doing the assessment in, our goal is to release the first responders within the first 10 to 15 minutes so that they can go back into service and be available for their areas of expertise, which would be responding to public safety issues or responding to medical emergencies, while we as the EMCOT clinicians would remain with the consumer in crisis and provide our area of expertise, which is the suicide lethality risk assessment, and then facilitating safety planning to determine the next best step for that individual. The majority of individuals that are seen through the crisis services, whether that be through Integral Care's EMCOT team, Integral Care's 24/7 crisis helpline, or a walk-in clinic at psychiatric emergency services, we are able to keep the majority of people safe in the community for community-based follow-up services.
How do we better integrate mental health resources such as EMCOT into our response model so that we get the right professionals in front of the right patients as soon as possible? The community in general has been interested in growing as the city has grown. So as we've added to the population, we've also added to resources available. We're very fortunate in that sense, and we continue to grow. There's a continual growth in terms of the mental health resources that are available, how we respond to those. We're looking at ways of responding differently to those emergencies, and so we've been very fortunate. What it looks like in 10 or 15 or 20 years, it could be anybody's guess.